I'd like to invite the program director of the White Ribbon Alliance in Sierra Leone, Amie Koroma. Amie Koroma today will be discussing her knowledge and her insights into exploring experiences with smartphone AI in fetal ultrasound, a study from Tonkolili, Sierra Leone. Welcome, Amie.
Thank you very much, Katia. Hello, everyone. I am Amie Koroma. I work in maternal and child health care, and over the years, I have worked with various health stakeholders to understand the health needs of women and children in order to better plan for those needs. I recently studied at Royal Tropical Institute, where I met Enya, and I came to know about the baby checker. I became interested in baby checker and decided to base my thesis study on it. Next slide, please. Next slide. Yeah. Do you know that in Sierra Leone, most healthcare workers would go through their medical training and have their entire career working in maternity without ever seeing an ultrasound scan, yet alone know how to use one? The same is true for most pregnant women. Most women in Sierra Leone have to go through multiple pregnancies and never have the opportunity to have not one pregnancy scanned. And this is sad because this is the reality of most healthcare workers and women in Sierra Leone. And there is definitely a need for innovative, cost-effective solutions in order to reduce these high mortality rates in Sierra Leone. Enya already mentioned the effectiveness of ultrasound and baby checker to be specific. And we know how it can identify risky pregnancies in order to reduce the maternal and child health outcomes. So the question is, will baby checker be one of those innovative solutions for Sierra Leone? Because we know its effectiveness, we know it works. But when you look at the Sierra Leone context, will baby checker work as effective as it is meant to be? Next slide, please. So a little bit of background of the pilots in Sierra Leone. So the baby checker was piloted in Sierra Leone, Tonkolili district since 2022, and it was integrated in routine antenatal care visits where free scans were provided to pregnant women. And based on the results of the baby checker, the pregnant women were either managed at the primary health care or referred to a secondary care for further care. So my study objectives was to explore the adoption and sustainability of AI fetal ultrasound scan, or specifically baby checker in Sierra Leone. And mainly we want to look at the knowledge and awareness around ultrasounds in general, but also looking at what are the barriers and influencers to implementing not just baby checker, but related AI-related devices in Sierra Leone. I spoke with healthcare workers and clients as participants, and I actually went to Tonkolili district and collected the data myself through key informant interviews with the senior staff from the Ministry of Health and Sanitation and also from the hospitals. I also spoke with the frontline workers who were using the devices themselves. And of course, I also met with clients, that is pregnant women and lactating mothers who underwent the scans in these facilities. As part of my study, I used the NAS framework to actually put up the objectives and also to analyze some of the data. Next slide, please. So what do we find out? So as part of the description of participants, I found out that most of the healthcare workers in Sierra Leone are women. So 90% of the health workforce is dominated by women, but unfortunately, these women are in the lower cadre, and also most of them have low background, educational background. Next slide, please. So these are the key findings. So when it comes to the knowledge and awareness of the baby checker, all of the participants interviewed mentioned that indeed the device identifies risky pregnancies And when it comes specifically to the clients, we're able to say that when we go to the healthcare facility, most of the healthcare workers will scan us and they will tell us whether or not our babies inside our belly are doing well or not. So you can see that they are aware of the baby checker's importance and they have to have their pregnancy scanned. When we look at the technology, the device itself being used, the user interface by healthcare workers, most of the healthcare workers, in fact, all of them said that the device was easy to use, mainly because of the visual guidance. The video indebted in the baby checker helped them to actually go through the pregnancy scan step by step, and they were able to self-train. One of the key aspects they also highlight about the baby checker was the traffic light system that is inbuilt in it that aids prompt referral. For instance, the baby checker will tell them whether or not they have to refer a pregnant woman or not. So as you can see, one of the healthcare workers mentioned that we realize that the scan helps us to reduce, for example, time spent on listening for a fetal heartbeat and determining the gestational period, which is difficult to do manually. We all know that human beings, we are great at doing things, but most times also we are not perfect. So, but with the technology, with the aid of the baby checker, they were able to actually identify some of these things. Next slide, please. So when it comes to perceived value, all of the healthcare workers and the clients mentioned that there is every need for the baby checker to be in their community, because for once, the pregnant women are coming for scans and they are strengthening other ANC services. So it increases ANC attendance. So women really appreciate the scans because it's proving to be effective. Also, it offers high diagnostic accuracy. So for instance, one of the pregnant women has to say, we even trust the device more than the healthcare workers because the errors are limited. So another client mentioned that many women have died or experienced stillbirth without knowing it before the baby checker gets to their communities and facilities. So indeed, they perceived it as having a high value. When it comes to adopters, they also mentioned because of the user-friendliness of the device, it was easy for them to adopt it within their routine work. So one thing I also find out is that technology is easy for healthcare workers to adapt if it can be easily integrated in their work. If it's a high burden, if it requires them to have on new documentation or new work to be done, it's difficult for them to have it adopted. So they said because of the user-friendliness of the device with clear instructions, it was easy for them to actually implement this device in their facilities. They also mentioned as part of adopting that the challenges including limited resources. For instance, they need examination bed so that they can use it to scan women. But in most of these healthcare facilities, you can only find one bed. Usually it's an admission bed that they will use to scan women. So they're struggling with this. So they mentioned that even though the baby checker device is good, it's working effectively for them, they need other facilities in their healthcare so that they can perform well overall. Next slide, please. So when it comes to organizational system, we see clearly the role of health system. So the weak health system in Sierra Leone comes out clearly because if you can identify a pregnant woman of having a particular issue, then you need to refer that woman to a secondary facility or tertiary facility. You then need something like an ambulance, or you need maybe medical drugs facility at the facility, but most of these things are not available. As you can see from a key informant that the reliability in Sierra Leone for proper procurement and restocking of accessories is a key problem. So this means that the weak healthcare system in Sierra Leone has an impact on any technology device being implemented. When you look at the wider system factors, we talk about policy and infrastructure gaps. So Sierra Leone does not have any policy that talks about high devices, technology-based devices or imaging devices can be used and implemented in the country. And also we are looking about infrastructures in terms of electricity, internet facilities. So as you can see, most of the healthcare workers did not mention internet or electricity as a problem, not because it's not an actual problem, but because most of these facilities we are provided electricity or solar powers by partners, so it was easy for them. But if you look at the rest of the country, electricity is a problem, access to internet as well as data is also a problem. So the issue of corruption also came out clearly because as stated by one participant saying that payment is also discriminatory. Some women are asked to pay while some don't pay anything for the same services. If you don't pay this money, you will not be scanned. They will tell you that the device is not available or not charged, and they will refer us to ILE, meaning the secondary referral hospital, even when we don't need to be referred. So as you can see, most of these issues affects the effective implementation of the device. And also generally the poor background, the general socioeconomic barriers hinder women from also coming to the facilities, mainly because if they come and if the healthcare workers tell them that this is the diagnosis, but then if we don't have drugs in place, if we don't have referral structures in place, then it's difficult for them to come again. Next slide, please. So when we talk about embedding over time, we're talking about sustainability, and generally we're talking about in Sierra Leone, there is very low digital literacy, and there are funding challenges that limit this. So as one of the participants mentioned, is that allocating the budget is okay, but then yearly subscription fee adds to the sustainability concern. This was discussed by a senior member of the ministry saying that the device works effectively. I've seen it, and we'll be able to lobby with the local government to pay for some of the devices. But then when you consider the yearly subscription of the baby checker device, then that's where the real sustainable concerns arise. So outside of the nurse domain, another key area that emerged was quality of care. So what I observed mainly is that the shortened ANC time, but issues with privacy and counseling during scans. So women do not spend more time at the health facilities, mainly because the healthcare workers now have this diagnosis tool to help them with their diagnosis. But then we find out that they lack time to counsel pregnant women, and they also do not give them the proper privacy, the proper education they need before they are scanned. And also if they are scanned, most times they do not give them the results of the scan, except when they need to be referred, and they will just tell them that you need to go to the referral hospital for further care, and that's it. But one key thing that came out was the high community acceptance. Women love the baby checker. They love to be scanned. They are coming all the time, and they're coming earlier, which is very good because then they can also be assessed for other ANC issues. So there are no sociocultural issues and high community acceptance. Next slide, please. So in conclusion, the baby checker is effective in the area that is actually enhances risk identification and ANC attendance, which is what we needed at especially the first trimester stage. It also facilitates task shifting because all the healthcare workers were able to actually implement and use baby checker effectively, but then we need to look at the gaps in terms of holistic care. Also, I mentioned that there is need for clear guidelines and consistent supplies to ensure quality integration. And over-reliance on the technology risks diminishing manual care skill. Because one thing I also mentioned, one of the participants mentioned that we are using the baby checker effectively now that we are losing our skills, and they are failing to understand the complementary of the device instead of taking over their routine rules. Next slide, please. So finally, what are the implications for implementation? So we need to ensure that We educate healthcare workers that technology is there to complement their existing knowledge and capacity and not to overtake the routine maternal and child health care skills and services they should be providing. Definitely, there is need to address the digital divide because there are infrastructural issues in terms of electricity, in terms of network and data in Sierra Leone. So these things goes beyond just the Ministry of Health, but also to other partners as well. There is need to invest more in funding and also in the infrastructure. There is need to strengthen the collaboration and research. And definitely there is need to refine the technology, baby checker, to fit the context of Sierra Leone, mainly with regards to the internet services, which is required to upload and download scans sometimes. So that's it. Thank you very much.
Thank you so much, Amie. Yeah, your study has been really insightful for all of us here at Delft and for our audience as well.